Hello, everybody. Good morning, good afternoon, good evening, from wherever you are joining us from. My name is Sibulele Sipata Nomganga, and I'm going to be your moderator today. Welcome to the Vuka Africa Health and Rights Dialogue for World AIDS Day. This year, the theme is Taking the Right Path, and we are talking all things crucial about the role of parliamentarians as well as civil society and the role they play when it comes to promoting human rights, equitable healthcare access, as well as inclusive policies that help us fight HIV and AIDS in Africa. Today, I am not here by myself. Trust me, I've got my esteemed colleagues who are going to help us drive this very important conversation. You may want to take some notes because this is about to be a flaming conversation. I am joined by Dr. Kalila, who is the Member of Parliament in Zambia. I'm also joined by Auntie Cecilia, who is the Executive Director at Hope for Future Generations, as well as Philip Nyakwana, who is from the Movement of Men Against AIDS in Kenya. Good afternoon, everyone, and welcome. I would like to
Good
get right
afternoon.
into our conversation because we all know the Vuka show is quite short. So we just want to really get into our conversation here this afternoon. And I see that Auntie Cecilia was just here now and she was a little frozen. So what I'm going to do is I'm going to go straight to Dr. And I'm going to ask you, what is the current impact of HIV and AIDS in your country, Dr. Kalila? And what are some of the most urgent challenges that Zambia faces?
Thank you very much for having me on this program. It's my first time, and I must say, what a very wonderful platform to be able to communicate to the world, especially as we count down to the World AIDS Day, during which time we remember those of our loved ones over many years whom
Yeah.
we have lost to HIV and AIDS, and encourage governments, civil society, MPs like us to always keep the flame burning. My name is Dr. Christopher Kalila. I am speaking from Lusaka, Zambia, where the National Assembly is, and I chair the Health Committee.
Nice.
Yes, Zambia, like most Southern African countries, has not been spared, and indeed was not spared from the HIV and AIDS pandemic. Right now, the country has achieved epidemic control. I must say, we have more than 1,200 people living with HIV and AIDS, all of them fully on ARVs, and our prevalence rates have dropped drastically over the years from an all-time high of as high as 2016, 14. Then it started coming down. Now it's less than 10%. So basically, as a country, we have seen tremendous progress in the fight against HIV and AIDS, but we are not yet there where we would like to be. Secondly, in terms of the challenges that we are facing, indeed, we are very worried now that we have begun to see new infections, especially among our adolescents and the youth, the young people. That is where the rate of new HIV infection is worrying us. Whereas, on one hand, we have made progress, but we have this uncomfortable situation creeping in. So, basically, in summary, two words: tremendous progress made globally, actually, it's not only in Zambia, thanks to the efforts of many stakeholders, the international partners such as WHO, UN systems, the church, the civil society, like many we have here, governments, members of parliament like us, and of course our researchers and academia who gave us ARVs, and now we have seen the rates drop drastically. So that's number one. But at the same time, we are beginning to see infections rising among our young people, which is the cause for concern. So I'll end here by that summary. Thank you, Sivulele.
Thank you so much, Dr. Kalila, for that. And I think, you are right. And it'll lead me to my next question after I've spoken to the other colleagues on the call. But really, you are right. While we've made great progress in certain areas, there's still a lot more to be done. And I appreciate your honesty. Because where there's accountability and honesty at your level, there is so much we can do. And you are saying, while we've done well in one area, there's another more concerning area right now that we need to put our efforts and focus on. And I'll get back to that area of adolescence in just a short while. But I want to go over to you now, Philip, and ask you, what progress have you seen that's been made against the fight of against HIV and AIDS? And how can leaders like Dr. Kalila be held accountable? Yeah. Yes.
Come again. Come
No
again. Come
problem.
again. You're not very clear.
So I was asking you that what progress have you seen being made in the area of HIV and AIDS, in the fight against HIV and AIDS, and how can leaders like Dr. Kalila be more accountable?
Okay. Thank you very much. This is Philip Nyakwana, and I'm speaking from Nairobi, Kenya. I hope I'm audible enough. I think I want to begin by saying that Kenya has made good progress towards managing HIV response. One of the progress is the enactment of some of the laws, repealing some of the laws, and having conversation and advocacy around some laws which criminalizes some populations and which has been an hindrance to HIV response. So in Kenya, we have managed, even though the progress has been a bit slow, but we are achieving. So that is one progress that I can say. Two is that, as we know, that the donor funding is dwindling, and there are a lot of conversations around sustainability beyond or after 2030. So we have had a conversation, and as a country, we have drawn a sustainability roadmap, and our roadmap will be launched on 1st during World AIDS Day that spells the measures and some of the measures that the country want to put in place to make sure that there are resources to sustain HIV response beyond 2030. Among other things, is coming up with legislation around domestic resource mobilization, also some legislation around social contracting, because as a country, we have never had a social contracting framework where the government can contract non-governmental organizations to and to implement HIV response. So we have also had some measures around advocating for the you is equal to you, so that people have a clear understanding that if you are undetectable, you are untransmittable. So we are using treatment also as a prevention of HIV. So quite a number. We have also seen quite a significant reduction of HIV, new HIV infection, even though of late with the current one, we have also seen this a little bit of upsurge, but we have managed. So I can also say that as a country, we are a country that has managed to achieve the UNAIDS 95 HIV targets and response. So I think we are on the right track, even though we also have some challenges, especially around inadequate resources. We also still have some challenges around data in terms of accuracy of data. And even of late, we enacted the law, the Data Protection Act, which we are still trying to implement. So we have made some good progress, but we also have some population that are still being left behind that we need to target. Like you realize men are still being left behind in terms of HIV response. But we also know they are also key drivers in terms of HIV infection. So I think we We have systems, we have strategies, and we also have some documents, the guidelines that are helping us in the response. So I think that's what I can say for now. Otherwise, we are making good progress. Thank you.
Thank you so much, Philip, for giving us a Kenya and East African perspective. Because while these countries in Africa may be struggling with a lot of the same challenges, each country will have its unique flair. And of course, we are aware and we know of the new laws passed, especially in East Africa, that could really hinder even more the progress that we need to make. So thank you so much for that perspective. I want to go back to
Thank
you,
you.
Dr. Kabila. And you mentioned that while Zambia, for example, has made great progress, adolescents have been found now to be having greater numbers and rates of infection recently. So I want to ask you, how do you think taking the human rights-based approach is going to help in the fight against HIV with this group in particular?
Again,
Yeah.
as you know, us were members of parliament.
Yes.
And being members of parliament, our primary responsibilities and actions as to enact legislation.
Right.
Okay, so I'm also aware that globally most of the countries have legislation around HIV. They have legislation that sets up national AIDS councils, or whatever we call them, but in other words, governance structures that are at the center to advise government and to implement the laws that we pass around the HIV space. These laws, number one, have to be human right based,
Yeah.
okay, ensuring that everyone is brought into the dragnet irrespective of who they are.
Mm.
Okay, what does that mean? It means every man and woman, child, girl is, as a matter of fact, as a government, we have to ensure that all health facilities, including testing and counseling, are available to them. This includes the key populations as well. What does that mean? It means we are not discriminating, and we, apart from a public health approach, we are also aware from a human rights angle that all of us are the same and we
Mm.
enjoy the same human rights. So there should be no discrimination whatsoever. In terms of spending resources, in other words, leaving no one behind, simply the mantra that is so much talked about worldwide, that no one should be left behind in our laws to look at HIV and AIDS. And that obviously we are doing here in Zambia. But like I said, we are concerned about this young group. And one of the reasons is that obviously they were not born at the time when HIV and AIDS was such a big problem in the world, so they did not see it.
Yeah.
They do not have a lived experience.
Yeah.
So we need to get back to the basics. We need to get back to
Mm.
the basics to them in terms of preventive
Sure.
efforts, sensitization, public awareness, behavior change. We need to go back to the schools, AIDS clubs, and so on, so that, and also encourage them to test, to come out public for those that test as a way of defeating. In short, lawmakers, members of parliament are change agents that must promote human rights, and they must ensure that no one is left behind. So in Zambia, there are so many programs going on to
Mm.
promote adolescent health. And one of the crucial sectors are civil society. Civil society have a responsibility
Mm.
to partner with government, to go out in the community, to translate the laws that we have passed us. Okay?
Yeah.
To conduct research, to generate data so that we use it to pass appropriate laws. So we rely on civil society. And that's all I can say for now. And this is what we are doing. And that is why we have done so well. Actually, we always say us, we are we are on our way to achieving. We have actually achieved epidemic control.
Great. Thank you
Yes.
so much for that, Dr. Kalila.
I don't
And
need to
I'm
say more.
definitely no, I think that was absolutely beautiful. And I'm gonna come back to some of the points that you've made. But I do see now that we've got Auntie Cecilia back on the call. And Auntie Cecilia, I just want to jump in and really ask you, how can communities, I know that you and your work is really communities based, and I wanted to ask you, how can communities most affected by HIV and AIDS be included, in the decision making, and what role do they play in leading change? Dr. Kalila just spoke about the importance of civil society in assisting lawmakers to make to pass laws that are human rights centered and based. And you are the one that works within those communities. And so, how can these communities make sure that they are included in the decision making rooms that Dr. Kalila sits in?
Yes, thank you very much. I'm so happy to be part of this. We need communities. We need to empower them. We need to create the space for them. We need to give them the voice to participate actively in all the interventions that are planned with them. Now, one thing we have to do is to ensure that we are deliberate in our efforts in creating that space for communities. Without community voice, all the investment, all that we are all doing, civil society interventions will not succeed. So the first thing I will say about creating that space for communities is to ensure that we hold their hands, we plan with them, we ensure that policies that exist in the countries are very friendly to communities, and also create the space to make their input into those policies, so that when the opportunities are there, we leave them, we give them that space, that seat for them to ensure that policymakers, everybody that implements interventions for communities, bring them along to that space. The second thing is to ensure that communities are empowered at different levels to speak to issues that affect them.
Yeah.
I will talk seriously about HIV first. Communities affected by HIV must sit at the table for every decision we are making for HIV. Without them, you cannot make decisions for them.
It's true.
Nothing for them without us. And I know in Ghana, civil society has been a very, very important platform that create those platforms for communities. And communities themselves can now create their own platform and demand their rights. Especially where Ghana, human rights issues are there, they make sure that they let the policymakers know that they exist. And civil society hold their hands, create that space for them. Where there are opportunities, we invite them, because when they are not on the table, we make sure that we invite them to come. And when they come to the table, they make sure that they are very visible. And being visible doesn't mean that you come and sit down, but being visible means that when you are on the table, you talk for all communities, you talk for all civil society. So whoever is on the table must talk for civil society. And we must be united, because it is not just one. We are together when we are strong, and unity is very important as civil society and communities. And we must also look at young people. We know that young people continue struggling in many, many, many African countries, because we don't see the need for young people's voice in whatever we do. Let me tell you that young people are very, very important, very innovative, very intelligent. We cannot keep them, we cannot shut them out. It is important that community, civil society, policymakers create that, and we must lead that advocacy with them. We must prepare them to lead the advocacy. We must agree on where they can raise those important issues and hold their hands and give them that space to demand their rights, because it is right issue. And if we ignore the rights of communities, ignore the rights of young women, ignore the rights of key and vulnerable population, let me tell you that we are struggling with 95, 95, 95. What we must know that the last 5 that to close the 95 are the vulnerable communities that we are not bringing on board. And those are the people who don't have the voice. And so we can never attain the 95, 95, 95 if we continue leaving those key and vulnerable population, those young people, those voiceless behind. We must create that space for them as young people, as people without voice, as key population and vulnerable population, as women, as adolescent girls and young women, to participate and create that space for themselves and for the future. And that is what we must all be looking at as civil society and communities. It's very, very important.
Great. No, thank you so much, Auntie Cecilia. And you don't know that you actually answered a question that we got from YouTube asking how can young people be effectively included in the fight against AIDS? And you just answered it. You just told us exactly what you are doing in Ghana and what more we should be doing to be including young people in the fight. I know you are passionate about young people, running Hope for Future Generations, and I know that's something that you could wake up at 2 o'clock in the morning for. So thank you so much. There is also a question for Dr. Kalila, but right now, I'd like to go over to Philip and ask you, what impact do you hope stronger rights protection will have on reducing the HIV challenge we have in Africa? So let's say we achieve what Dr. Kalila spoke about, and we achieve what Auntie Cecilia has spoken about. What impact can we then expect to see from the fight against HIV?
Yeah. Okay. Thank you very much. The impact we can see is very big, but I want to go back and say that we can only manage to see the impact if first we address the human right related barriers that affect some populations or communities. So we must be strategic in terms of addressing human right related barriers. If we address some of these human right related barriers, we would want to see the uptake, the increase in uptake of HIV services across and among a different population. If the uptake is high, then we should be able to also reduce the negative impact. So it can also lead to economic growth. People will become healthy. The quality of services will improve. And therefore, we can say we'll have a healthy and a productive nation, so or world. So what I have to say is that we need to be strategic and address both structural, mostly because nowadays we have drugs, but we also must address structural barriers that hinders the uptake of some of these services. If we are able to address those structural barriers, then we'll see the improvement in quality of services, and we'll also see the improvement in terms of health of people. And if people's health improves, that means we'll not also be spending a lot in terms of resources towards HIV response. And when people are healthy, we know that they'll be productive in a way that they are able to do their work, they are able to generate income on their own and for them. So if we reduce the impact of HIV, we will see the growth in development. We need to see the people being productive, and we are able to see, we'll also even be able to see the reduction on human right abuses. So those abuses we'll also be able to see. So the reduction, if we manage the response well, we are able to see the growth across board. So that's what I may say from now. And again, as we address this, if we are able to address those human rights related barriers, then we'll also be able to see the relationship between and among different populations will improve, because we'll be talking of less or no discrimination, also based on your status or based on your sexual orientation. So we will see a lot of positive impact if we are able to manage HIV, both socially, economically, and everything else. Thank you.
Philip, thank you so much for painting that beautiful picture of of how and why we are all on this call, of why we all do what we do. You have put it so beautifully how economically things will change, socially things will change, and really just for inspiring us to continue doing what we do. Now, before I take one last round from all my guests, I just want to read a few comments here. Sizwe Kuluwe says, our Honorable Kalila, we are led. Thank you so much. We then also have
5 minutes.
Nigel, who's saying, who's asking a question, but then I'll get one of you to mention that. What roles or opportunities can young people take part in order to actively join the fight? Auntie Cecilia, I'll let you answer that. Sis Rosemary is saying, great stuff. Thank you, Honorable Kalila, Sis Cecilia, Comrade Philip. Thank you, Sibu, for joining this conversation. Somebody else says, Viva! Honorable Kalila, as legislators, we are not discriminating as we leave no one behind. Viva! So just from those, colleagues on the call, that the work you are doing is absolutely important. And so with that, I'd really like to ask Honorable Kalila to answer the question around domestic resource mobilization for health. What do you feel are some of the gaps that you are having to deal with as someone who is really in the hot seat there in Zambia when it comes to leading the health committee in parliament? How can Africa start investing in its own healthcare system? How are you starting to do this in Zambia? You are mute.
Keeps coming. Am I? I think
Yes,
I'm on.
you're fine.
Can you?
Yes.
Yeah, I'm saying that this is a very important question that keeps cropping up in various conversations around HIV financing. First of all, as you know, health spending is very critical because all nations ideally should spend a lot of their resources on fixing the health of its citizens. You can't fix an economy without fixing the health of your people. And in so doing, here in Africa, you are all familiar with the story of the 15% Abuja declaration by our heads of states in 2001, when they met in Abuja and said that in order to spend optimally on health of our people, at least each member state should spend 15%. Unfortunately, only probably 2 countries in Africa up until now have been able to meet this. But that's not so important as it is to realize where this money is going to. Okay, where is the money that they spend going to? Now, in strengthening health systems, many things have to happen. You have to recruit health workers, you have to build infrastructure, you have to buy equipment, you have to improve your supply chain by buying medicines, including ARVs and so on and so forth. Now, so sometimes the money is not enough. So there is need, therefore, for countries to come up with innovative ways of increasing resources for health, and in particular for HIV and AIDS programming, which in most countries, including ours, is still very much donor supported. Our treatment program, most of the commodities are very much supported by PEPFAR. Okay, some of the programs are supported by the Global Fund and so on and so forth. And I'm sure it's the same in many other countries. However, I would like to tell you that over the years, we have also seen a steady increase in countries' contribution to their own health, but we are not where we want to be. I think most of it, somewhere, if I have to put it conservatively, 40%, in some cases up to 80% of the HIV national responses are donor supported. And we don't want that. Because what happens when the donors leave, or for some reason there are some changes in their respective countries? What will happen? So I agree with you. Our call to action as legislators always should be to see many of our countries increase their fair share of domestic financing to HIV and AIDS and several other programs. This is very important for sustainability. We cannot bank on others spending on our health. The question you ask, what is being done? Indeed, a lot is being done because Africans have realized all this. Apart from the Abuja Declaration, I think somewhere around 2018, President Paul Kagame convened a meeting on the sidelines of the African Union in Ethiopia. It was the African high-level discussion on domestic financing, at which a range of proposals and measures, first of all starting with countries, impressing upon them to realize that we need to spend more on the health of our people, and various methods have been proposed. One, you must be efficient so that the money that you spend, every dollar or whatever you put, must have a return. You cut out bureaucracy, red tape, corruption, and all these things so that there's value for money. Number two, you must also leverage on the private sector.
Yeah.
Okay? Private sector cannot thrive if the citizens they are saving do not thrive. So you can't have all these multinationals hoping to profiteer when the people are sick. Who's going to buy their products? So they have a responsibility to spend. Then number three, you need to come up with other methods to put in an extra dollar into your kitty. And we have seen countries, for example, Zimbabwe has an AIDS levy. Okay? We have most of the HIV/AIDS laws have inbuilt in there one levy of one sort or another. This is all aimed to bring in an extra money. And then more recently, including in Zambia, we have seen the emergence of insurance, health insurances. In Kenya, I know there's the health insurance. In Zambia, we enacted one in 2018. South Africa has recently enacted one, and many countries are doing that. Why are they doing that? This is the whole attempt to make universal health coverage a reality by ensuring that all people are covered, they are not worried about cost, and wherever they are reached, respective of who they are, to support and promote human rights. So you have insurance. Others are moving towards seeing taxes. I learned recently that some countries are putting a tax on sugar consumption. You see, some of the things that you consume actually have a telling effect on your health. And if we put more tax on that to discourage you from that, at the same time we raise more resources to put towards our health sector. So there are all these methods. Then, like in our case, we actually had a whole session as parliamentarians in the Health Committee with Minister of Health, I think, and Waki, supported by Waki Health and others, to develop a domestic financing strategy. And we call upon our friends in various other countries to develop a domestic financing strategy. Why? This is to mitigate in other words, to try to think sustainably, to fill in the gaps that will be left by the donor community, to begin to own our own health, so that then if they leave, I mean, look, the role that PEP has been playing over the years. We are very grateful as members of parliament to the US government. We are very thankful to the Global Fund. We are very thankful to DFID and many, many bilateral and multilateral partners who have supported our health here in Africa. But we feel that they have done enough, and it's time we fill into the shoes. So your question is correct and it's right, and indeed steps are being taken, but more needs to be done. And I think we need to continue talking. If you look at the African Union scorecard for health spending, it's scandalous in most countries. They are allocating very little, and therefore they can't afford to do more for HIV. They are waiting for PEPFAR and others. I think it's high time now that we implemented these measures that I've talked about. Thank you.
Thank you so much for that, Dr. Kalila. Thank you. So inspiring to hear and see that we have leaders like yourself in parliament who are making decisions knowing that it's in the best interest of the people of your country. Really, I think you have captured the spirit of this year's World AIDS Day theme, which is taking the right path. And I'll come back to my closing comments about some of the things that you have said. Auntie Cecilia, I want to come to you with your wrap-ups, please. And I think what would be really appropriate for me to ask you before I head on over to Philip for his closing remarks is, What opportunities are there for young people to get involved? Young people want to get involved in the fight against HIV and AIDS, but sometimes we just don't find the opportunities. So, what opportunities are there for young people to get involved?
Okay, so thank you very much. I will say that there are opportunities. The first thing I'll talk about is young people need to be very deliberate and intentional in creating that space for themselves, because in most of our African cultures, we don't really see the need of involving young people. We believe that, or we think they don't have voice. So, for example, let me talk about Global Fund. Global Fund now has Youth Council directly under the office of the Executive Director, Peter Sang. A big opportunity for young people, and it is looking at young people in all the Global Fund implementing countries. And so they are represented based on regions. That is one first place that I will say that young people should connect with those people. And if they pass through the CRG, they can get the contact of those people and connect with them and make sure that their voices, their needs are integrated in Global Fund interventions in their country. The second place that I would really encourage young people to be is the CCM, Country Coordinating Mechanism. That is the first place we have to make sure that young people are well represented there, because when decisions are taken, when resources from the Global Fund comes into the country and they are not part of the development of the grants, at times they are missing when it comes to implementation. And so young people must be represented, and they must make sure that information get to their peers outside the CCM to collect information and the needs, especially young people living with HIV, living with TB, key and vulnerable population on human rights issues. The second place I want to raise is that PEPFAR and all other partners, are UNAs, are very, they need the voice of young people. The bilaterals, the multilateral, create that space for them. And so young people living with HIV, key and vulnerable population, should look for UNAs in their countries and ensure that the UNAs connect them to where their opportunities exist. And they do that because they do that a lot in Ghana. They hold the hands, they partner civil society to ensure that young people, for example, under Hope for Future Generation, currently we are working with over 700 young people living with HIV. We are working with over 700 young people living with HIV. And these young people are not just young people sitting there. They are in school, they are working, they connect, they know what they need, and they are young people living with HIV, TB, and malaria, and they understand the issues. We connect them to very important platforms for them to make their voices and influence policies. So it is important for young people to connect with Ghana Health Ministries of Health, DFID, USAID, different partners, even the French embassy. They contribute a lot. And the embassies are there open to really hear their voice and help them, because they are all important and they are represented on platforms. Another place that young people can really connect to themselves is parliamentarians. Many of the parliamentarians are also young people in Africa now. And so when they are able to connect with them, they can give them the opportunity to make their voices heard. They can influence policies of the country, and they can really make sure that the policies that affect them really affect them to make decisions. Another place I want to share with young people that they can also connect with, which is very important, is so many youth networks that we have in Africa. We have youth networks across Africa. And these youth networks have other connections in Asia and different places. So it is important to connect and learn and network and ensure that we don't just wait for people, but we get our own deliberate efforts into all those spaces that create future for us to become very important people as we grow into adulthood. So briefly, this is what I want to just connect young people to. On the CCM, all the decisions are taken. And Global Fund is very deliberate in bringing young people on board. And so we need to be very deliberate to make sure that we seize these opportunities and ensure that we also advocate for Global Fund Aid replenishment. We should call the donors to put in money for Global Fund Aid replenishment. Civil society communities, we are all calling that at least 18 billion should be put into Global Fund, and our governments in Africa should contribute to domestic resources to ensure that the solidarity support that we're supposed to be giving to Global Fund, PEFA, and everybody, we are showing that solidarity through our contribution to HIV, TB, and malaria. Thank you.
Thank you so much, Auntie Cecilia, for that. We know that you are in the middle of planning of other platforms, so thank you so much for that. And really, in closing, we've really taken up too much of your time already. Philip, I'd like to come back to you for closing remarks. Just what can we look forward to this year and this World AIDS Day from you and the movement of men the movement of men in Kenya?
Thank you very much. Two quick ones. No population will be left behind, especially if we are talking of ending HIV or by AIDS by 2030. Two, we must address human rights related barriers that hinders access to HIV services. Three, we want to see a strategic way of committing resources towards HIV response, domestic resources. People talk, including parliamentarians, but we still rely on donor funding for our support. We must look into our budgeting processes and see, have we committed specific budget lines towards HIV response, or do we still lump them together with the health budget? And if you lump them together with the health budget, then they get lost in between, and we go back to our relying on donor support. So we need to commit specific resources within our local budgets towards HIV response and see. So we also must be strategic with our sustainability conversation. The question I keep on asking people that they ask, as we have our sustainability conversation, and this will be my parting thought, what are we sustaining? Are we sustaining people living with HIV? Are we sustaining the resources? Are we sustaining? So what is it that we are sustaining beyond or after 2030 in HIV response? But above all, resources. Two, human rights related barriers must be addressed. But lastly, the people living with HIV must be at the center of the response. Thank you.
Thank you so much for your words, Philip from Kenya, for just, really, once again, you've painted a picture of what needs to happen for us to get on the right track, for us to get on the right path. And that path is the human rights-centered approach path. Thank you so much to Dr. Kalila, to Auntie Cecilia, and to you, Philip, for reminding us that we need to get back to basics, as Dr. Kalila said. We need to get back to basics. We've done well from following the basics. There was something right about following the basics. And so we need to get back to the basics. And when we say we leave no one behind, it is an automatic statement that says the word no one means that we don't discriminate. And therefore, with no discrimination means that we have honored everyone's basic human rights. So thank you so much for reminding us of that. Thank you for reminding us that this year, when we take the human rights path, we honor people no matter who they are, where they come from, or where they find themselves. Thank you so much to my guests and to all that has joined us today. Have a wonderful, wonderful weekend, as well as do take time to honor those this World AIDS Day who have lost their fight, those who continue to fight, and for all our affected communities. Goodbye.